You can also end up with heel pain, knee pain, backaches, all because your bite is not correct. So it's important to get your crooked teeth fixed not because of aesthetic reasons, but because of your bite issues.
Back pain.
Yes.
Like you can literally get back pain if you have a bite problem.
Yes.
Dr. Kanupriya, welcome to Infinite Health. Thank you so much for coming.
Thank you.
Dr. Kanupriya, I always grew up and, when I saw people around me, some had like beautiful teeth, the perfect smile, and some had crooked teeth. But, I always thought that it was cosmetic in nature. I mean, as we grew up, we understood that it needs to be corrected. But why is it important to get your crooked teeth fixed?
Anand, crooked teeth, as a child, it might not really seem much to the child. I mean, the child is not bothered about it. But it's more important to get the bite corrected because the bite correction is something that will cause problems much later on in your life, like when you're 50, 60. You might even, surprisingly, it must be very shocking for you, but you can also end up with heel pain, knee pain, backaches, all because your bite is not correct. So it's important to get your crooked teeth fixed not because of aesthetic reasons, but because of your bite issues.
Back pain.
Yes.
Like you can literally get back pain if you have a bite problem.
Yes, because the thing is, it's all the muscles are related to each other. So we are using our masticatory muscles. Now, all your masticatory muscles, starting from your masseter, temporalis, they all form a chain. And once this muscle is affected, your masticatory muscles are affected, the entire chain reaction, right from your spine to the buttocks to, behind your legs, all the muscles, they get affected. And we've had patients who've had chronic heel pains. They're going for physiotherapy for years on end. It's not helping them because they had a
Wow.
bite issue. And they've lived with crooked teeth all their life, so it doesn't really bother. It doesn't matter to them because aesthetics is not one of their concerns. But it's not aesthetics we are looking at. We are looking at correcting your bite, correcting the muscle tension, which in turn corrects all these different pains and aches that you have.
That's really surprising, genuinely. But how do I know that I have a bite problem?
So, see, your dentist will be able to diagnose that for you because once you come to the clinic, they will diagnose. There will be dental signs as well. Plus, we have muscle palpation. We press certain points in your muscles which will be so tender that you would not even, you'll jump out of your chair because muscles become so tender. And plus, your dental signs will be there. There'll be dental wear and tear. You might have sensitivity. You might be living with it thinking it's pretty normal and using, some desensitizing toothpaste because they are available very freely over the counter. Sensodyne. And, there are so many others. So you might be using that thinking it's fairly normal because you hear sensitivity is common with so many other people. And also because you don't really relate muscular pain to, dental issues. Nobody has that correlation.
Absolutely.
So once patients, usually they come to us when they've had it and, nothing is working out for them. And they just happen to come to us for a regular dental checkup. And when we are talking to the patients, they randomly tell us, oh, doc, we've been suffering from this pain for so long, when we are chatting. And that's when we explain it to them, and that's how the treatment then starts to progress.
But is there any visual thing that they can look at in the mirror or something? Because, sometimes most people will never identify back pain or jaw pain or tooth sensitivity with maybe a bite problem. Like, is there visually something that a patient can see and say that I need a bite correction?
So see, visually there aren't too many signs that you will be able to see. Visually, what a patient can maybe see is that, teeth wear, that the height of your teeth is, it's gone down over the period of years, the height of the teeth has gone down. Apart from that, there won't be too many dental signs. It will mainly be pain. Pain is the main factor that you need to look into, because if you have pain and you've seen your orthopedic, you've seen your physiotherapist, and the pain is not going away.
So, would you recommend a person who has such kind of body pain in different parts of his body go to a dentist regularly anyway, irrespective of whether he identifies those signs or not?
Absolutely. Absolutely. Because if you have any sort of pain, please visit your dentist. Please ask them to evaluate your bite. They will give you a splint. They might give you a splint to wear 24 hours, just remove it while you're eating food, and, wear it for a prolonged period of time, maybe for a few weeks, few months, and then reevaluate you, because the muscles become so tensed. Sometimes it takes months for us to deprogram the muscles.
Right.
In some patients, the muscles get deprogrammed very fast. But in some cases, the muscles become so tense, it takes a long time for the muscles to get deprogrammed also. So it's only when the muscles get deprogrammed does the pain start to subside. And once the muscle is deprogrammed, we need to see which position your teeth are in. It might not be in the same position that you are used to biting your food in, because in that position, the muscles are again in tension. So
Hmm.
now the new position where the muscles are relaxed, you need to now get your teeth fixed in that particular position.
Right.
Yeah. So now you need either Invisalign or you need crown and bridges, full mouth rehabilitation to fix your teeth in that positions, so that now that you're eating in the new bite, your muscles are not under tension.
So you mentioned putting a splint. What exactly is a splint?
So basically, a splint is something that is fabricated and the patient has to wear it. It's made of either plastic, acrylic, a material like that is put in the patient's mouth. So basically, the teeth don't come in contact with each other. Because when the teeth don't come in contact with each other, the muscles don't know where to be, so then, because the teeth are forcing the muscles to be in a particular position.
Hmm.
Now when the teeth are not coming in contact, the muscles don't know where they have to be, so automatically they come to their most comfortable position. When the muscles come to their most comfortable position, that process is known as muscle deprogramming. So when the muscles come to the most relaxed position, at that position the teeth are again not touching. So now we need to give you something so that you can chew your food properly when the muscle is relaxed. That's
Hmm.
when we need to shift your teeth into a correct position.
Right. And that's when you use Invisalign.
That's when we use Invisalign to put your teeth into the correct position.
Just to understand this, most splint is put like in between the
In
teeth.
between the teeth. So it's like something like how you would wear an aligner. It's similar to that, but
Okay.
it's much thicker, because in an aligner your teeth are still touching each other.
Hmm.
But a splint is much thicker and different, so that your teeth are not in contact. It's only one point contact.
So
All the other.
can someone have go through Invisalign or the braces and then still wear a splint for bite correction?
No, so when we give you the splint, your muscles are deprogrammed, and then we are giving you Invisalign to get your teeth into that position. So after your correction, you don't need the splint after that anymore, because now your teeth have come to the position where your muscles are relaxed.
So the only reason I'm asking you is that I personally went through Invisalign as well, but I was never given a splint. So
So you did not need a deprogrammer.
okay,
Probably your muscles were not that tense. You did not need a bite
right,
correction.
right.
You went through Invisalign for aesthetic reasons, like,
Hmm.
because you mentioned earlier to me. So, I mean, it can be for different reasons that you
Right.
need Invisalign.
But Dr. Kanupriya, what about the opposite spectrum? So people might not have pain in their body. People might be absolutely fine. They might say that I have crooked teeth, but hey, I'm fine. Like everything is fine. I have no back pain, front pain, and everything, their health might be perfectly fine. What are the potential risks of not correcting a bite issue?
So, today you might be fine. Tomorrow you might not. And when you are in pain, the process of reversing it is more difficult. So, we want to be on the preventive measure rather than correcting a disease which is already in action.
Hmm.
So, if I see a bite problem, we want to correct it before it causes symptoms. Because once the symptoms are there, to reverse them, it takes a longer period of time.
Right. So take us through the whole process of, correcting your bite.
So, correcting your bite can be done in 2 or 3 methods. First is you could undergo braces, or you could go for prosthesis, which means that you could undergo crown and bridge. So these are the methods where we correct the bite. Now first we have to analyze what is your correct bite. Now, as we discussed earlier, first to come to the diagnosis, we have to give you a splint or a deprogrammer to deprogram your muscles, so your muscles are in a relaxed position.
So that's step one.
That's step one, deprogramming your muscles. Once we know where your muscles are in a deprogrammed state, we record that position. We now know that this is the position where your muscles are most relaxed. Now I want to move your teeth to that position where your muscles are most relaxed. So now to move your teeth to the position where your muscles are most relaxed, I can use Invisalign to shift your teeth into that point, or I can give you crowns, bridges, artificial methods to move your teeth into that point.
I'm sorry, what are crowns and bridges?
Crowns and bridges are basically, when we cut your teeth and we give you a covering over the tooth.
Okay, that's a crown.
That's a crown. And a bridge is when you have a missing tooth and I'm replacing that missing tooth with an artificial tooth.
Artificial tooth.
But not an implant. When I'm
Right.
replacing a missing tooth with a crown like prosthesis, that's known as a bridge. So I can give you crowns, bridges. I can also give you implants in the new position if you have a missing tooth, that is. So there are different ways where I can replace, get your teeth to follow where your muscle position is the most relaxed.
So bridge is literally when the teeth is broken somewhere in the middle and
The teeth is missing.
the teeth is
The
missing.
tooth is missing. Yeah.
Okay,
So
so then
suppose
it's
you
an
have one
implant or a
tooth,
bridge.
it's an implant or a bridge. So like just how the name suggests, bridge. What is a bridge? You have a water body, it's connecting point A to point B. Now the
Right.
water body is the missing area where you don't have the tooth. So I'm
Okay.
connecting one tooth to the other tooth with a bridge in between, which is the missing tooth.
Right.
Yeah.
So, as I understand it, step number one is a splint or understanding whether the teeth needs a splint or not
Exactly.
to diagnose the right position of the muscles in
Muscle.
your face.
Yes.
And then once we've diagnosed that step, the second step is we use braces or Invisalign and crowns and bridges to basically
Get your teeth to that position where your muscles are most relaxed. If your muscles are relaxed, you will not have any of the aches and pains.
right. And then uh, once those two steps are done, is that over? Is there any other thing that you
No,
need to
that's
add?
it. That's it.
And also, I just wanted to ask, like, is there something like is there a correct posture standard protocol for everyone, or it could like the kind of bite correction could differ
It
between
differs.
jawlines of different people?
It differs because, see, some people might need very minor corrections. Like, some bite corrections could be like just about 10 seconds, 15 seconds, where just one tooth is a little high and we just grind that tooth and the muscles are relaxed. It could be a 10-15 second thing. In some cases, it might just be one crown that needs to be done. In some cases, it might be that all 32 teeth need to be done. So the severity of the bite correction can really vary.
And once the Invisalign is done, so my understanding is I'm just summarizing for a lot of people who are watching this because there's so many people with misaligned teeth who'd want to know. Like the first step, like we discussed, was the splint and maybe diagnose where the muscle needs to be, and then it's Invisalign or braces. Now the third step, because I'm also there at this point of time, like they put a wire.
The retainer.
No, there's a wire also behind the teeth.
Yeah, that's a fixed retainer.
That's a fixed retainer.
That's a fixed retainer. So we can have retainers of two kinds. One is a removable retainer. One is a fixed retainer. A fixed retainer is basically the wire that you're talking about. So that is to hold your teeth into position. Now, what happens is the teeth have a memory of their own and they want to go back to where they were.
Right.
And the retainer holds them into that particular position. So every time we move your teeth, we have to give you retainers for at least 2 years so that your teeth lose their memory and they stay in the new position we've assigned to them. Yeah.
Now, I have to ask you this because you're saying 2 years because so many people I've met who have got like braces when they were young have been wearing those fixed retainers for the last 10-15 years maybe.
If they can, 2 years is minimum.
Okay.
2 years is minimum. But if the retainer is not bothering you, we can just let it be. Because, because I don't want to take a risk. What if your teeth do shift back? And plus, when you do, orthodontic correction at a younger age, you're still growing. So there are higher chances of relapse. Whereas when we do adult orthodontics, the chances of relapse, it's not because your bone is not undergoing so many changes anymore.
Right.
So, then when we say 2 years, it's like, because we know you're not growing anymore. So the chances of relapse is much lesser. That's why, but in kids, because, once we correct the bite, once we do their orthodontic correction, but the child is still growing, the bone is still undergoing changes, there's still growth spurts coming in. So then we want the retainers for much longer in children.
But then would you say that like for children, they can stop after 10-15 years, but for adults, they can stop earlier maybe?
Yes.
Okay.
So children need to wear retainers for much longer. Adults can stop after 2 years.
Right.
Yeah, 2 years is minimum. If they can wear for longer, we don't want to take a risk.
Right.
The longer they can wear the retainer, it's always better.
No, because it's a narrative that like, once you get a fixed retainer, it's for life. Like you can never remove it.
No, you can remove it. It's not that you can't remove it. And in some cases, we do remove it also because, sometimes we've also seen patients where the jaws are trying to grow and the retainer is hindering the growth, because of which they are developing pain. So there have been cases reported like that also where you have to remove the retainer, because it's impacting the growth and, the growth spurts are like kind of, there's a mismatch. So there have been cases reported like that also. So it's not like it's for life, but like I said, why take a chance? If it's not bothering, if it's not interfering, if oral hygiene issues are not a problem, because with retainers, sometimes we see oral hygiene issues become a problem because you have to, floss under the retainer also because that becomes like a plaque trap. So if oral hygiene issue is not a problem and the patient is comfortable, we let the retainer be.
Right. So again,
Yeah.
just to summarize, step one is identifying the correct bite. The second step is the aligners and the
Or the crowns and
or the
bridges.
crowns and bridges, and then we get into the fixed retainers.
Yes.
But then, what's the next step? Is there a next step?
If you are a bruxer, like if you are somebody who's grinding your teeth at night, then maybe a night guard.
Right.
Yeah.
Because, like, especially, does that also impact like people who mouth breathe?
So see, for mouth breathing, technically there is nothing that you can do to stop mouth breathing. It's just habitual, and that you have to physically try and stop mouth breathing, because there is no appliance. I mean, there is an appliance that we can give you, but mouth breathing does not interfere with deprogramming of muscles.
Right.
Yeah, that
Right.
doesn't interfere, because if you are a mouth breather, then automatically your mouth is open, your teeth are apart.
But
So
what about cosmetic dentistry, in the sense that a lot of people who use veneers? Like, how safe are veneers?
if done correctly, they are very safe. Now, veneers are supposed to be within enamel. Veneers are not supposed to go into the dentine of your teeth. The teeth has 3 layers: the enamel, dentine, and pulp. So, veneers are supposed to stay within the enamel of your teeth. If it is, it's very safe. The minute we start aggressively cutting your teeth, the minute we go into the dentine, that's when it becomes a problem, because that's when I'm aggressively cutting your teeth, and it doesn't serve the purpose of veneers, because veneers have to be in enamel. So if done correctly, it's absolutely safe
And how long can veneers be?
for life.
Also, if I'm 35 and if I'm using veneers, it could just be there
Yeah,
till you die
absolutely.
and won't impact your teeth in any which
Nothing,
way.
nothing, nothing. It can be for life, as long as you're maintaining it well. It's, I mean, flossing. By maintaining it well, I mean you're maintaining your oral hygiene protocols correctly. Absolutely.
So, just to follow up to that question, like, then is it safe to get metal implants?
Yeah, metal implants are absolutely safe. Implants are made of titanium, which is again a very biocompatible material, and they have a very, very high success rate. So they're absolutely fine to get metal implants done.
Because there's so many of these American rappers like 50 Cent and Jay-Z. They have these bedazzled things
Yeah,
on
those
their
metal
teeth,
grills they
those
have.
metal
Yeah.
grills
So,
they have.
again, if they're removable, like how you see a lot of actors when they're doing some movies and they need prosthesis to have their teeth look in a certain manner. So they are removable prosthesis. So the
Okay.
metal grills also, they can be removable or they can be fixed. So if it is removable, it's okay, because then I'm not really altering the structure of your teeth or doing anything. I'm just giving you a prosthesis which is removable. So that's absolutely okay. The minute you want to cut your teeth and the minute you want to do something fixed, that's when it becomes a problem.
Right.
Because now I have taken away your natural tooth structure, and there is nothing, trust me, there is nothing which substitutes natural teeth. Because however good my materials may be, it is not as good as what you originally have. So I don't want to take away anything extra unnecessarily.
But as someone who's been practicing for so long, like, just to get your closing comments on this, like, what do you see in the world today? Like, how many people do you see with crooked teeth? And how many people do you think have naturally beautiful, perfect smiles in general?
So, there is a data which says that 90% of the people require bite correction. In my practice, personally, I would say 95 to 98% people require bite correction.
Wow.
But it's just that people don't know the importance of the correct bite. Like we discussed earlier, they don't have any symptoms. So, people don't give, you come to a doctor only when you're in pain. Not, as a preventive measure, there are very few people who come. So, it's not causing you a problem. You don't see the need. It's not been discussed a lot. So, it just gets neglected. And then by the time you realize you're in your late 50s or maybe 60s, and then you feel that ab kara ke kya karenge, it's already too late, and you just start popping in pills and things like that. So it's very important to have an early diagnosis, get the diagnosis done when the symptoms have not yet started appearing, and get your bite corrected.
Dr. Kanupriya, thank you so much for this conversation. I think this is a very good template for people who are looking to get their bite corrected, and a good
Yes.
awareness that pain does not mean just taking B12 and D3 injections.
Yes.
It also means going to your dentist, and I hope they come
Yes.
to you. Thank you so much again for coming
Thank you.
here.
Pleasure. Thank you.